So good evening to all of you. So good evening to all of you. Okay, we'll start. So today's topic that I've selected for you is the dural venous sinuses. The dural venous sinuses that everyone wanted this topic yesterday. The sinuses within the dura mater. The dural venous sinuses. Okay. Yes. So good evening to all of you. And before I start, I'll just give a brief about this. We have got a plus subscription. There are daily live classes, structured courses, live quiz, and unlimited access to the material. Iconic subscription, you've got the best of Unacademy and the notes of pre-planner. This is a limited time offer. We have slashed the prices. 3 plus 1 month offer, 3 months, you get 1 month free. And now we are starting with the first prof classes. The classes would be in the evening, spread over a period of 6 months. We follow a general pattern. We follow standard pattern. So different states will have different exams, different dates of exams and all. But we follow a general pattern, a standard pattern. Okay, so everyone would be benefited by it. This is NEET PG Season 1 and FMG Test and Analysis batch, which we are starting from 12th of May. Target next 2022. And we have got some 34,000 curated MCQs for you. And you can download the Unacademy app. Okay, so here I start. So topic for today is dural venous sinuses. Dural venous sinuses. Now tell me, which is the outermost meninges of the skull? The outermost, that's the dura mater. Next is the arachnoid mater, and the last one is the pia mater. Now this dura mater, the topic is dural venous sinuses. This is a very important topic for all of you. Listen to this and understand. Now this dura mater, the dura mater splits into two layers. It splits into two parts. One part goes close to the skull. Now what is the inner aspect of the skull known as? The end ostium of the skull, end ostium. So this dura mater splits into two layers. This part goes close to the endosteum of the skull, and this is what we call as the end ostial layer of the dura mater. And the second layer goes close to the arachnoid mater. It goes close to the arachnoid. So this is what we call as the meningeal layer. Okay, so the dura mater splits into two layers. One layer goes to the skull, that's the end ostial layer. The second layer is known as the meningeal layer, and between these two layers, it encloses a space. Now tell me, what is a space known as? A space is known as a sinus. So these sinuses are within the dura mater. And what does this sinuses contain? They contain venous blood. So all the sinuses which are located within the dura mater are therefore known as the dural venous sinuses. Okay. So it's within the dura mater and it contains venous blood. So all the sinuses are therefore known as the dural venous sinuses. Clear? So topic for today is the dural venous sinuses. You all know me. I'm Dr. Pradeep Pawar. Okay. Now starting with this, I made some models for you. Look. Now tell me, what is this part? What is this aspect? Yes. So what is this part of the dura mater? This dura mater is going to split the two, is going to be present between the two cerebral hemispheres. It is present between the two cerebral hemispheres, and this is what we call as the falx cerebri. Just have a look at this. This is what we call as the falx cerebri. Tell me, what is this part of the brain known as? That's the corpus callosum, right? That's the corpus callosum, and this dura mater is attached to the corpus callosum here. It is attached to the corpus callosum like this at the lower part, and just above the corpus callosum, it splits here. just above the corpus callosum, it is going to split. Okay, so just imagine here is the corpus callosum. Okay, just imagine the corpus callosum here, and these are the two cerebral hemispheres, the corpus callosum. Now this is the fold of dura mater which is attached below to the corpus callosum, and above it is attached to the sagittal suture. Okay, above it is attached to the sagittal suture. This is going to separate the two cerebral hemispheres, and this is what we call as the falx cerebri. Falx cerebri. Okay, so this fold of dura mater which separates the two cerebral hemispheres is known as the falx cerebri. The lower border of the falx cerebri is attached to the corpus callosum. It splits over the corpus callosum. It divides over the corpus callosum, and it encloses a sinus here. What is this sinus known as? It encloses a sinus here, and this is what we call as the inferior sagittal sinus. Okay, this sinus which it encloses here is known as the inferior sagittal sinus here. That's the inferior sagittal sinus. Okay, now the same dura mater, this falx cerebri, as we go up, it splits, and this is attached to the sagittal suture here. It is attached to the sagittal suture. It encloses a space here, and it encloses a sinus here, and this is what we call as the superior sagittal sinus. Okay, so superior sagittal sinus is present at the upper border of the falx cerebri. So this becomes the superior sagittal sinus present at the upper border of the falx cerebri along the sagittal suture. The inferior sagittal sinus is present above the corpus callosum. Above the corpus callosum. Is it clear to all of you? So this is the falx cerebri. Falx cerebri. Okay. Now understand this now. Just one moment. Just see this. Tell me now, what is this part of the brain? One moment. I'll just make a. Tell me, what is this part of the bone here? What is this part of the bone known as? Answer this. What is this part of the bone known as? This is very hard like a rock. Answer what you call this as. This is known as the petrous part of the temporal bone. The petrous part of the temporal bone. And what is this bone behind? What is this bone behind? This is the occipital bone. Occipital bone. So there is a fold of dura mater. It is like this. See, I made this for you. It is something like this. This is how the fold of dura mater is. So this is attached exactly here. So where are these two ends attached to? This one, these two ends are attached to the petrous part of the temporal bone, to the petrous part. These two sides are attached to the petrous part of the temporal bone, and behind this is attached to the occipital bone like this. Okay, so this is attached to the petrous part of the temporal bone. This is attached to the apex of the petrous part of the temporal bone, and behind this is attached to the occipital bone. Now what is this going to separate? This, who's going to lie on this? The occipital lobe of the brain. And who's going to lie below this? The cerebellum. And this is acting as a tent for the cerebellum, and this is what we call as the tentorium cerebelli. Tentorium cerebelli. Are you following this? So see, this is how the tentorium cerebelli is. I'll make it on this side for you. Just have a look at this. This is how the tentorium cerebelli is. I'll just clear this. So how is it attached to look? This is how the tentorium cerebelli is. You can see this now. It is attached on either sides to the petrous part of temporal bone, and behind it is attached to the occipital bone. And this is what we call as the tentorium cerebelli. Tentorium cerebelli. Who's going to lie on this? The occipital lobe of the brain. And who's going to lie below this? The cerebellum. And you know, there's a space here. There's a notch like this. Look at this. There's a notch here. There's a gap here. Look at this. Look at this gap. So where is the petrous part of the temporal bone? Where is the tentorium cerebelli attached to? It is attached to the petrous part of the temporal bone laterally, and behind it is attached to the occipital bone here. So if this becomes the tentorium cerebelli. See, this is so nice. Understand this. That's how the tentorium cerebelli is going to be. Who's going to lie on this? The occipital lobe. And who's going to lie below this? The cerebellum. And why is this space left here? Why is this gap left here? If you can answer this, why is this gap left here? There's someone who has to pass through this gap. Answer this. There's someone who has to go down through this gap. Can you answer this? Just one moment. Tell me, what is this part of the brainstem known as? Yes, the brainstem. Yes, the brainstem would be passing through this. What is this part of the bone known as? What is this part of the bone known as? If you can answer this. What is this part of the bone known as? It's a slope like this slope. This part of the bone is sloping downwards. And this is what we call as, this part of the bone is sloping downwards. And this is what we call as, answer this, what do you call this? This part of the bone which is sloping downwards. It is sloping downwards and it is going towards the foramen magnum. What is that known as? Clivus, not sella turcica, my child. Sella turcica is this, no? Sella turcica is this in which the pituitary gland lies. That's the sella turcica, right? This is the sella turcica, yes. And this is what we call as the clivus. So from the sella turcica, there's a slope like this. It's a slope like this. And this slope will eventually lead us to the foramen magnum. And who's lying on the slope? The brainstem. And that's how the brainstem lies on the slope and comes down towards this foramen magnum. And who emerges out through the foramen magnum? The lower part of the medulla and the meninges. They get out through the foramen magnum. Are you getting an orientation? Yes, are you getting an orientation to this? So the brainstem has to pass through this. So the brainstem would be passing from here. From this region, the brainstem would be going down. And that is why the gap is there. Okay, clear to all of you? Yes. Right, I'll just clear this for you. That is known as, sorry, what happened? Pranav? That is known as the tentorial notch. Tentorial notch. This one, no? This is known as the tentorial notch. Yes, the open part is known as the tentorial notch. And through this, the brainstem passes. Now see, if I place this like this, no? If I place it like this for you, see, I hope you can see this like this, huh? Like this. It is exactly like this. Okay, this is fine. So now you tell me, who's here? Who's here? Who's here on this side? That's the superior sagittal sinus. And who's here down? Who's this? That's the inferior sagittal sinus, right? Now, the superior sagittal sinus goes like this, like this, like this. And the moment it comes back, it goes to the right side. You can see this. The moment the superior sagittal sinus goes back, I'll show you like this if you can understand this. This is the superior sagittal sinus. The moment the superior sagittal sinus goes back, it turns to the right side. And what is this sinus? What is this sinus which is enclosed in the tentorium cerebelli? Look, the tentorium cerebelli splits over the occipital bone. Here, it splits over the occipital bone. It encloses a sinus here. And this is what we call as the transverse sinus. Okay, so that is what we call as the transverse sinus. So where are the transverse sinus located? In the tentorium cerebelli. The tentorium cerebelli goes back and splits here, encloses a sinus here. That's the transverse sinus. Now just have a look at this. See if you can understand this. This is fine, no? I'll place it like this. Look. So what is this sinus on the top? That's the superior sagittal sinus. This superior sagittal sinus comes back. It comes here. I'll show you like this. That's the superior sagittal sinus. It comes back here and now goes to the right side. It now goes to the right side. It is now known as the right transverse sinus. Okay. So superior sagittal sinus continues as the right transverse sinus. Okay. And now what is this sinus? That's the inferior sagittal sinus. The inferior sagittal sinus comes here. Just one moment, have a look at the slide. The inferior sagittal sinus The inferior sagittal sinus comes here. Look at that. What is that? That's the inferior sagittal sinus. It will start from here. The inferior sagittal sinus will start from here, come back, and come till here. That's the inferior sagittal sinus. Now, it runs in the tentorium cerebelli. It goes straight behind. And what you call this sinus as now? That's the straight sinus. You understanding? So inferior sagittal sinus comes till here and now goes straight behind in the tentorium cerebelli. It is now known as the straight sinus. The straight sinus would now turn to the left side. What do you call this as? This is the left transverse sinus. Yes. Are you all following this? All of you? Are you all following this? This model is clear to all of you. So this is the falx cerebri. That's the tentorium cerebelli. The falx cerebri is resting on the tentorium cerebelli like this. The falx cerebri is resting on the tentorium cerebelli. On the superior border of the falx cerebri is the superior sagittal sinus, which now goes to the right side. That's the right transverse sinus. On the inferior border of the falx cerebri is the inferior sagittal sinus, which now runs in the tentorium cerebelli, and this is what we call as the straight sinus. And now it goes to the left side, that is now known as the left transverse sinus. Clear till here to all of you? Yes. And now both this transverse sinus now becomes an S. It becomes an S. And what is this S known as? And this S, both the transverse sinus would now become an S. Look at that. And what is this S known as? The sigmoid sinus. So right, so now it becomes the sigmoid sinus, and that is why it looks in the form of an S. That's the sigmoid sinus. And now this sigmoid sinus, what happens to the sigmoid sinus now? The sigmoid sinus, one moment. Okay, I'll just put a new slide for you, new screen for you. What happens to the sigmoid sinus? If you can just tell me what happens to the sigmoid sinus. So sorry. The sigmoid sinus passes through. The sigmoid sinus passes through. Okay, I'll just make that for you. I'll make that for you. Tell me, what is this? I'll draw with the highlighter here. What is this part of the bone? You tell me. One moment. And look, this is so nice. Just quickly, I'll draw this for you. Yes. What have I drawn for you? Answer this. What is this that I've drawn for you? Chalo, bolo. What is this view? Where are you looking this from? Where are you looking this from? There are some problems. We'll discuss that later. Okay. What is this view? Tell me, what are we looking at? What are we looking into? Yes, we have cut the skull cap, we have opened the skull, we have cut the skull cap, we have opened the skull, and we're looking from up, we're looking from up. And this is the interior of the cranium. We are looking from above, so that's the interior of cranium. Tell me now, what is this bone here? What is this bone here? That's not base of the skull, my child. That's not base of the skull. Base of the skull, you're lifting the skull up and you're looking from down. That's the base of skull. This is not base of the skull. We have cut the skull here. We have opened the skull and we're looking from the top. So this is the interior of the cranium. Okay, I'll start. Quickly, you tell me, what is this? What is this that I've drawn? What is this? Chalo, a rapid fire for you. Answer. What is this? This one. You can see the pointer, no? This. What is this known as? This is the lesser wing of sphenoid. That's the lesser wing of sphenoid. Yes, that's the lesser wing of sphenoid, and that's the petrous part of the temporal bone. Petrous part of the temporal bone. I'll just make a big pointer for you. What is this now? That's the petrous part of the temporal bone. That's the lesser wing of sphenoid. Okay, that's the lesser wing of sphenoid. That's the petrous part of the temporal bone. Okay, I made this another pointer for you. Is this visible now, this pointer? No? Okay, fine. That's okay. I'll draw that for you. Chalo, what is this? You tell me. What is this? I'm marking now. What is this here? That's fine. What is this here? That's the lesser wing of sphenoid. What's this here? That's the petrous part of the temporal bone. So what is this cranial fossa? Answer now. This is the anterior cranial fossa. This is the middle cranial fossa. And this is the posterior cranial fossa. Just tell me quickly, what is this foramen? What is this foramen? What is this foramen? And what is this foramen? Yes, first one. Answer now. A rapid fire for you. What is this first foramen? First foramen. This you should know. First. Foramen. Answer. The first one, foramen, uh, foramen rotundum. This first one is foramen rotundum. What is this foramen? I'm highlighting it. I'm highlighting it. That's the foramen ovale. What's this behind the foramen ovale? Foramen spinosum. And what's that? That's the foramen lacerum. This is the foramen lacerum. So if I go down through this greater wing of sphenoid, if we go down, where are we? Where are we? Tell me. From this greater wing of sphenoid, if we go down, where are we? I have just told you this yesterday. Where are we? If we go down through the greater wing of sphenoid, where are we? Infratemporal fossa. Excellent. That's the infratemporal fossa, not pterion. That's the infratemporal fossa. And yesterday, this is what I was telling you. If you are in the infratemporal fossa, and if we look up, what are we looking at? The greater wing of sphenoid. You're following this? And you'll find two foramens here. What's that? Foramen ovale and foramen spinosum. So that's the infratemporal fossa. Yes, you got it. Now tell me, what is this part of the bone? This is the petrous part of the temporal bone. Petrous part of the temporal bone. And you tell me there's a foramen here. I want this. I'm interested in this foramen. I'm telling you all this for this foramen. What is this foramen which is divided into 3 compartments? Answer this. Yes. What is this foramen which is divided into 3 compartments? That's the jugular foramen. Jugular foramen. That's the jugular foramen. And this jugular foramen has an anterior compartment, middle compartment, and a posterior compartment. Anterior, middle, and posterior compartment. Okay. Now look. You tell me, what is this sinus here? What is this sinus? Here, what is this sinus? That's the transverse sinus. The transverse sinus now becomes an S. S. What is this? Sigmoid sinus. And the sigmoid sinus will now get out through the posterior compartment of the jugular foramen. Okay, the sigmoid sinus would now get out through the posterior compartment of the jugular foramen. It's now outside the skull. It is now known as the internal jugular vein. Is this clear to all of you? That means internal jugular vein is a continuation of sigmoid sinus, right? So the sigmoid sinus itself gets out through the posterior compartment of the jugular foramen. It is now known as the internal jugular vein. Internal jugular vein. Yes, very good. Sankadeep, right. What passes to the middle compartment of the jugular foramen? You've already answered that. That is 9th, 10th, and 11th cranial nerves. Okay, fine. Clear to all of you? So I'll just make a flowchart for you. Understand this. I'll just write this down for you. Yeah, this is fine. I'll write it like this. One moment here. Chalo, start. What is this? Superior sagittal. Very good, all of you. Superior sagittal sinus. Superior sagittal sinus. What does it continue as? The superior sagittal sinus continues as the right transverse sinus. Right transverse sinus. Wait, no, I'm telling you, Tohid, right transverse sinus. The right transverse would become the right sigmoid sinus, and this will now become the right internal jugular vein. Internal jugular vein. Is this clear to all of you how the internal jugular vein is formed? Now coming to the inferior sagittal sinus. Inferior sagittal sinus. Inferior sagittal sinus first continues as what? The inferior sagittal sinus is a small sinus. It starts from front, it comes till the tentorium cerebelli. Now it runs in the tentorium cerebelli, and this is what we call as straight sinus. Is this clear to all of you? Straight sinus. Okay, so inferior sagittal sinus first continues as straight sinus. The straight sinus then becomes the left transverse. Left transverse, then the left sigmoid, and the left internal jugular vein. Left internal jugular vein. Is this clear? Fine. And look, this is so nice. Look. Tell me, there's someone here. There's someone who's lying. One moment, this selection of colors. There's someone who's lying here. What's this big sinus? What is this big sinus here? This is what we call as the cavernous sinus, right? This is what we call as the cavernous sinus, and the cavernous sinus is lying on either sides of the body of sphenoid. Okay, it's lying on either sides of the body of sphenoid. So what would the body of sphenoid form for the cavernous sinus? What relation would it be? The sphenoid, the body of the sphenoid, the coelator ceca. What relation for the cavernous sinus is that going to be? Yes, what is that relation? That's the medial wall of the cavernous sinus, right? So the medial wall of cavernous sinus would be formed by the sphenoid and the coelator ceca and the sphenoidal air sinus. Sphenoidal air sinus. Okay. See, what is this foramen which I had drawn here for you? What is this foramen? The foramen, that is the foramen, yes, lacerum. And if you put the cavernous sinus on the foramen lacerum, you just put the cavernous sinus on the foramen lacerum. Where is the foramen lacerum now with respect to the cavernous sinus? You take the cavernous sinus and just put it on the foramen lacerum. So now you tell me, where is the foramen lacerum with respect to the cavernous sinus? Yes. It's in the floor. It has gone down. It's in the floor of the cavernous sinus, right? So the foramen lacerum lies in the floor of the cavernous sinus, and there's a big artery which is entering the skull through the foramen rotundum. Who's that? A big artery entering the skull through the foramen rotundum, and that's the internal carotid artery. So the moment internal carotid artery enters inside the skull, it's right in the floor of the cavernous sinus. It's right in the floor of the cavernous sinus, right? So that's how you get the relations of the cavernous sinus. And now you tell me, this cavernous sinus, look, this is so nice. Just try to understand this. This cavernous sinus is connected to the transverse sinus. This cavernous sinus is connected with the transverse sinus. That's our transverse sinus, right? So the cavernous sinus is connected to the transverse sinus. How? This is the petrous part of the temporal bone, and this petrous part will have two borders. One is the superior border, one is the inferior border. So there's a sinus which runs along the superior border, and this is what we call as the superior petrosal sinus. Very good. So what is the superior petrosal sinus going to connect? It connects the cavernous sinus with the transverse sinus. It connects the cavernous with the transverse sinus, right? So in fact, the superior petrosal sinus is going to drain. It's going to take the blood from the cavernous sinus to the transverse sinus, right? And there is one more sinus here. Just have a look at this. There's one more sinus which runs along the inferior border of the petrous part, and this is what we call as the inferior petrosal sinus. This inferior petrosal sinus passes through which compartment? I'll draw this as the jugular foramen. This is the anterior, this is the posterior, and that's the intermediate compartment. Okay, so inferior petrosal sinus passes to which compartment? It passes to the anterior compartment of the jugular foramen, right? It passes to the anterior compartment of the jugular foramen, and it goes outside the skull. It is outside the skull. And tell me, who comes through the posterior compartment? That's the sigmoid sinus, and the sigmoid sinus now becomes what? What is this big vein now? That's the internal jugular vein. So tell me, this inferior petrosal sinus would drain into what? What would the inferior petrosal sinus drain into? Internal jugular vein. Very good. In fact, the first tributary of internal jugular vein is, your answer, inferior petrosal sinus. Are you following this? The first tributary of internal jugular vein is going to be the inferior petrosal sinus. Now clear? Tohit, clear with the doubt that you had? So that's how it is. Right? In other words, the inferior petrosal sinus drains the blood. It takes the blood from the cavernous sinus to internal jugular vein. Internal jugular vein. It takes the blood from the cavernous sinus to internal jugular vein. Is this clear to all of you? Understood the sinuses, the superior sagittal, the inferior sagittal, the right transverse, the left transverse, the right sigmoid, the left sigmoid, the superior petrosal, the inferior petrosal sinus. Okay, I'll just show you one slide. Look, this is a very good slide. Just have a look. All your doubts will be clear now. This is fine. Chalo, you be quick and start. I'll start. A rapid fire for you. Rapid fire. Chalo, start. Identify. Here we are. Here we are. Here we are. What's this? What's this? What's this? Identify this. Answer. That's the superior sagittal sinus. You can write in short. Superior sagittal sinus. What's this now? What's this? Superior sagittal sinus goes to the right side. What's that? That's the right transverse sinus, right? The right transverse now becomes an S. S. What's this? What's this? That's the right sigmoid sinus. That's the right sigmoid sinus. And the right sigmoid sinus would now get out. It becomes the right internal jugular vein. Okay, what's this? Here we are. Now clear to all of you, what is this? This is the inferior sagittal sinus. Now this inferior sagittal sinus continues as what? What is this now? That's the straight sinus. That's the straight sinus. So inferior sagittal sinus continues as the straight sinus. What is this now? What is this now? That's the left transverse sinus, right? That's the left transverse. That's the left sigmoid. That's the left sigmoid. And that's the left internal jugular vein. That's the left internal jugular vein. Perfect, perfect. Is this crystal clear? And tell me, what is this sinus? What is this sinus? Look at that. This is the cavernous sinus, and this is connecting the cavernous sinus to the transverse sinus, and this is cavernous to the transverse. This is the superior petrosal sinus, right? So that's the superior petrosal sinus, and from the cavernous sinus to the internal jugular vein, that's the inferior petrosal sinus. Inferior petrosal sinus. Is this clear to all of you? Understood? So this is about the sinuses of the dura mater. Answer this MCQ. Yes, all are paired venous sinuses except, very good, all are paired venous sinus except superior petrosal. Yes, superior petrosal was along the petrous part, superior border of the petrous part of the temporal bone, right? Inferior petrosal, yes, along the inferior border of the petrous part. Superior sagittal, no, superior sagittal is a single, it is an unpaired sinus. Transverse, yes, right? So answer is C for this, C. Very nice. Answer is C. Cavernous sinus, I have to tell you. I have not told you the cavernous sinus. Is this clear? Now understand this cavernous sinus. I'll make this cavernous sinus for you. Okay. How is the vein of Galen formed? That's the venous drainage of the brain. That's the venous drainage of the brain. Two internal cerebral veins joins to form the great cerebral vein of Galen. And that thing, yes, you got the great cerebral vein of Galen, Tauhid. You got the great cerebral vein of Galen, I think. So that is why you're asking me this. Yes, yes, very good, my child. Look at this slide once again. Okay, what is this vein? Very nice, Tauhid. What is this? What is this vein? This vein which is coming and joining the straight sinus, this is the great cerebral vein of Galen. Excellent. Very good, Tauhid. That's the great cerebral vein of Galen. This is the inferior sagittal sinus, right? This inferior sagittal sinus continues as what? Straight sinus. And what is this vein? I didn't purposely tell you that. That's the great cerebral vein of Galen. And how is this great cerebral vein of Galen formed? What is the deep vein of the brain? We'll see this in some other topic. The deep vein of the brain is known as the internal cerebral vein. One is on this side, one is on this side. So two internal cerebral veins joins to form the great cerebral vein of Galen. Okay, so that's the great cerebral vein, and this great cerebral vein of Galen drains into the straight sinus. Very good. It drains into the straight sinus. That's nice. So we'll come to in some other lecture about the venous drainage of the brain. Venous drainage of the brain. Okay. For now, I start with this. Tell me if this is the cavernous sinus. Okay, that's the cavernous sinus here. In brief, I'll just tell you the cavernous sinus. Tell me what is medially. Who's lying medially? What's that? That's the pituitary gland. What is that? Vein of Galen. Okay, so that's the pituitary gland. What is this? What is this? Air sinus. It's an air sinus. There's no venous drainage and the arterial supply will discuss in some other topic, my child. Okay, so what is this? This is the sphenoidal air sinus. That's the pituitary gland and that's the sphenoidal air sinus. This becomes the medial relations of the cavernous sinus. What is present in the lateral wall of the cavernous sinus? This is the third nerve. This is the fourth nerve. This is the third nerve, fourth nerve. This is the ophthalmic division, and this is the maxillary division of the trigeminal nerve. Maxillary division. So the third nerve, the fourth nerve, the ophthalmic, and the maxillary division of trigeminal nerve. Recent edition of Grace does not include the maxillary division also. You have to see the option and answer accordingly. Okay, but till now, Harrison and all are still including maxillary division in the lateral wall. Okay, so for now we take maxillary division in the lateral wall. To see the options and answer accordingly. You have to see the options. And who's lying in the floor? What is this nerve? Yes, that's the sixth nerve which lies in the floor, and there's a big artery in the floor. What's this big artery? That's the internal carotid artery. Internal carotid artery. So who's in the lateral wall of the cavernous sinus? The third nerve, the fourth nerve, the ophthalmic, and the maxillary nerves. And in the floor would be the sixth nerve and the internal carotid artery. Medially is the pituitary gland and the sphenoidal air sinus, and the roof you get something like this. If you can tell me what is this here? What is that? Who's forming the roof? This is the optic chiasma. Optic chiasma. Okay, this would be done in pituitary tumors. Pituitary tumors. Transsphenoidal approach. Okay, clear to all of you? Yes, answer this MCQ. So cavernous sinus is related to all except, that's the mandibular nerve. Mandibular nerve. Mandibular nerve passes to foramen ovale, and mandibular nerve is much away from the cavernous sinus. Okay, there was one AIMS MCQ some years back. In cavernous sinus thrombosis, all the following would be seen except. Okay, so options were pain along the distribution of third nerve, pain along the distribution of fourth nerve, pain along the distribution of sixth nerve, and the fourth option was loss of jaw jerk. Loss of jaw jerk. So jaw jerk is not lost. Who mediates this jaw jerk? The mandibular nerve. And mandibular nerve is not related to the cavernous sinus. It's much away from the cavernous sinus. So the jaw jerk would be intact. Okay, jaw jerk would be intact in cavernous sinus thrombosis. Clear? So the jaw jerk would be intact. Right. Answer this MCQ. Dangerous area of the face is so called because of its connection to the cavernous sinus through. Yes? This type will not be there. I have already I'm already putting this clinical MCQs. There's a separate topic of clinical MCQs for the NEET entrance students. Okay, so those are clinical questions. This is something that I'm just showing you in the course of lectures. Okay, we are discussing clinical MCQs for NEET 2021. That's a separate topic, Wasim. Okay, that's a separate lecture altogether. I'm just showing this some MCQs which were there, so at least you have an idea here. So what is this? Through. Answer is the superior ophthalmic vein. Superior ophthalmic vein. Okay. So I'm taking this separate lectures. This were some MCQs which were left with me. So that is why I'm showing you this. Quickly tell me, how does the infection from the dangerous area of the face spread to the cavernous sinus? Have a look. Infection from the dangerous area of the face, how does it go to the cavernous sinus? So that's about the dural venous sinuses. I've told you all the dural venous sinuses. I've told you the cavernous sinus. I've told you the falx cerebri, the tentorium cerebelli. Okay. And how are the sinuses, where are they located, and how do they continue as? I'll just tell you this also. I've got some more time left. So tell me, how does the infection from the dangerous area go to the cavernous sinus? Okay, have a look at this. Right, this part of the face is known as the dangerous area of the face, and I draw this as the cavernous sinus here. I'll make this as the cavernous sinus. So how does the infection go? The infection from the dangerous area first goes to this vein. What is this vein which is coming like this? What is this vein which is coming here? That's the facial vein. From the facial vein, it goes up, it goes up. What is this vein known as? Angular vein. And from the angular vein, there's a vein which goes to the cavernous sinus. What is this known as? What is this known as? This is the superior ophthalmic vein. Superior ophthalmic vein. So superior ophthalmic vein, yes, these veins are valveless. They can carry in both the directions. So this is the superior ophthalmic vein, right? So dangerous area of face, facial vein, angular vein, superior ophthalmic vein, and the cavernous sinus. And the second way of spread of infection, dangerous area of face to the facial vein, and this vein is known as the deep facial vein. There's a pterygoid venous plexus, and this pterygoid venous plexus lies in the infratemporal fossa. This pterygoid venous plexus is lying over the lateral pterygoids. They lie over the lateral pterygoids, the pterygoid venous plexus. And when this pterygoids contract, all the veins are drained out of the blood. Okay, all the veins are drained out of the blood. Pterygoids are therefore known as the peripheral hearts. Peripheral heart. So look here, dangerous area of face, it goes to the facial vein. From the facial vein, deep facial vein, to the pterygoid venous plexus, and from the pterygoid venous plexus through the emissary vein, it goes to the cavernous sinus. Cavernous sinus. So what are the veins which connects the veins outside the skull with the veins inside the skull? These are the emissary veins. Emissary veins. And this pterygoid venous plexus would lie over the pterygoids in the infratemporal fossa, and when this pterygoids contract, all the veins are drained out of the blood. Pterygoids are therefore known as peripheral heart. Peripheral heart. Okay, so this is about the lecture. So I have got a separate course. We discussed this MCQs for NEET that I'll be starting again from Thursday. So last month we had discussed this clinical MCQs for NEET 2021. From this Thursday, Friday, Saturday, Sunday, it's in the morning. Okay, clinical MCQs for NEET 2021. So in that, there's a clinical scenario which is given, and we try to correlate with anatomy the same way which is asked in the NEET. Okay, Wasim, fine. And then we have got this FMG E revision, the MCQ discussions, and then we are starting with the plus lectures now for FMG, and we are starting with the professionals, the first professionals on plus. Okay. And see this. That's it. So once again, this is the plus subscription that we have: daily live classes, live quizzes, structured course, and unlimited access. This is the iconic subscription. You get the best of Unacademy and the pre-platter. This is a limited time offer. The prices have slashed. 3+1 month course, 3 months. In that you get 1 month free. And now we are starting with the first professional. We are starting for the first year MBBS. Alternate evenings, 6:30 to 8:30. And even though different states will have different universities, they will have their own syllabus. We follow standard format, and these lectures will be recorded, so you can see these lectures later if that portion is not there for your exam. Okay. And we are starting with the NEET PG Season 1 and FMG Test and Analysis. This is from 12th of May. Target next 2022. And this 34,000 curated MCQs for you. And that's about the course. Download this. Okay, fine. I hope everything is clear to all of you about the dural venous sinuses. So keep on attending this free sessions. And if you are there for the plus sessions, come to that also. Okay, thank you to all of you. Thank you to all of you.